So at this time, I have checked the patient's orders. I'm going to be walking into the patient's room. My name is Krystal Garcia. I'm going to be RN assisting you today. I'm going to be assisting you in your tracheostomy care. At this time, I want to make sure that the records match. Can you please provide me with your name and date of birth? The records match. The patient has confirmed she has no allergies to iodine, latex, or shellfish, and no allergies at all. I have confirmed that the patient has no pain, and on a pain scale, she has a pain of 0, on a pain scale of 0 to 10. I have educated the patient on why we are doing this today. We are doing it to avoid any infections and make sure that there's no infections or abnormal inflammation. The patient understands, and I will be now providing the patient with privacy. I'm going to be washing my hands and donning regular gloves. I'm going to be placing the patient in a high Fowler position. I'm going to assess the patient's vital signs and as well as the anterior 6 lung sounds and the posterior 10 lung sounds. And then I'm going to, I note that there's no adventitious sounds at this time and that everything seems to be normal. So I'm going to move on to my supplies, and I'm going to open up my, my tray, and I'm going to place it using the 1 centimeter border here. And I'm going to, at that point, check my saline solution, make sure that it's not expired. It's not expired. I'm going to not cross my sterile field, and I'm going to pour some of the saline on each one of the little trays. At this time, I'm going to also grab the sterile draping on a 1-inch margin and place it in my sterile field. Okay. And I'm going to wash my hands and don sterile gloves. Okay. And at this time, my sterile gloves are in place. I'm going to walk back to my sterile field. And sorry about that, that was an accident. I'm gonna walk back to my sterile field. I'm going to place all of my materials out of it. So this time I have my brush in my sterile field. I'm going to dip my 2 Q-tips in the saline solution and also place it in my sterile field. I'm going to remove my string for my tracheostomy tube. And I'm also going to remove my pipe cleaner, my venisated gauze, and I'm going to be removing 2 gauze as dry gauze, and 2 I'm going to be placing in the saline and squeezing out the excess and placing it here as well. At this time, I'm going to take my non-dominant hand and I'm going to grab the patient's cannula. I'm going to take it over the basin. I'm going to grab my brush. I'm going to dip it in the first tray and brush and make sure that there are any drainage, anything that's occluding is going to go into the first tray. Then I'm going to not cross my sterile field, and I'm going to get rid of my brush, and I'm going to place it in the second tray, the cannula into the second tray, making sure that it rinses out any possible type of debris that's still in the cannula. At that time, I'm still with my non-dominant hand. I'm going to take the cannula and I'm going to dry it with the pipe cleaner with my dominant hand. Make sure that it's completely dry. I'm going to dispose of the pipe cleaner while not passing through the sterile field. And at this time, I'm going to place the cannula back into the patient's tracheostomy with my non-dominant hand still in place. And I'm sorry, I keep touching my glasses, they keep falling, so it's really not happening. So then I'm going to, at this time, grab one of the Q-tips and start cleaning under the patient. Okay, and then I'm going to dispose of it, and I'm going to take another Q-tip and start cleaning over the patient, and I'm going to dispose of it. Then I'm going to get one of my wet gauze, and I'm going to clean under the patient, dispose, get another wet gauze, clean over the patient, dispose. Then I'm going to get a dry gauze, and I'm going to go under the patient again, making sure that there's no excess moisture that stays and lingers, and dispose. And I'm gonna get my last dry gauze, and I'm gonna go over, and I'm also going to dispose. At this time that I've cleaned and I make sure the area is well cleaned and there's no moisture left over, I'm going to get my facilitated gauze, and I'm going to, while still having my non-dominant hand on the patient's tracheostomy, I'm going to place with my dominant hand it under the patient's tracheostomy tube. Make sure that it's in place. And at this time, I'm going to still grab, with my dominant hand, grab the string. While still having the old string on the patient, I'm going to loop the new string and make sure that I put a loose knot. That's something that's not going to be very hard for the next person to take off in case of any emergencies. I'm going to allow the patient about 1 to 2 fingers of space when moving around it. And then I will also, while still having the old string attached, put the new string. Make sure it's a not super tight knot. It's a loose knot that's easy to take off. And I will then, once I make sure that that new string is in place, I will remove the old string and dispose of all my materials. I will take my sterile gloves off. I will make sure that the patient is in no type of discomfort or pain, and there's no bleeding or any type of perclusions or purulent drainage. At that time, I will also I will wash my hands and don new gloves, and I will assess the patient's vital signs again, and I will also auscultate the patient's anterior lung sounds, 6 lung sounds, and posterior 8 lung sounds. And once I have assured that the patient's in good health and there is no complications with this, I will document any of the drainage color, odor, amount, and if it was occluded or in any way, and I will let the provider know, and I will dispose of my PPE materials as necessary.